Good afternoon, ladies and gentlemen. Today, I would like to talk to you about the immune system boosting in oncology through acupuncture. In 1987, I treated my first cancer patient. It was a 18-year-old young man with a shin cancer. He had to undergo intensive chemotherapy every 3 weeks. After the first chemotherapy session, I noticed that his platelet and neutrophil count plummeted. Platelet fell from 220,000 to 87,000. His neutrophil count fell from 2,400 to 880. I had the idea to puncture lung 7 in bilateral and in toning. 4 days later, I ordered another blood test, and we found that his platelet count had risen to 160,000 and his neutrophil cells to 1,400. 15 days later, 40 hours before his second chemotherapy session, we do another blood test and disappointment. His platelet count has dropped back down to 95,000 and his neutrophil count to 980. I immediately scheduled another acupuncture session and managed to get his chemotherapy rescheduled for 48 hours. 48 hours later, another blood test, and everything was fine. Platelet had risen to 125,000 and neutrophil at 1,300. It means that therapeutic effect of lung 7 collapse in a week, and that we need to add other points to strengthen and extend this therapeutic effect. Yes, but which one? I found the solution in George Ruiz Moore's book, which contained a lot of information. I select the point that would give us the desired and expected therapeutic effect. It took me a year to find the right points, the right protocol, which I now use with all my patients. These points are lung 7, large intestine 4, gallbladder 39, stomach 36, and spleen 2. All are used in bilateral and in toning. Here is a diapo of neutrophil cells. Now, blood platelet. And here is a picture of stomach 36, large intestine 4, excuse me, gallbladder 39. Excuse-moi, là, il faut que je déplace ça parce que ça me... Ouais, okay, so...
No, spleen 2.
Spleen 2. Spleen 2. And... Pourquoi ça ne va pas?
Let's go.
Okay, and lung 7. Okay. This protocol of 5 points give us excellent results in over 70% of cases. Chemotherapy courses can take place on the scheduled dates. These scheduled dates are very important for a lot of patients. Here is an example. It's an unforgettable true story. I saw in my office Mr. W, 69 years old. a very famous French actor. He had just been diagnosed a lymphoma with large cells. The oncologist informed him that, that he would have to undergo 6 cycles of air shock every 2 weeks. At the time, this actor was performing in a high successfully play in which he had the main role, and he had about 100 performances scheduled. Doing this, the oncologist asked him to cancel the performances or find a substitute. In both cases, it was impossible. I met this actor at this time. After reviewing his medical file, I explained to him my treatment strategy. First of all, he would not experience any of the predicted side effects. Secondly, thanks to 5 specific points, his immune system would be maintained at a stable level, and thus his chemotherapy treatments would proceed without delay. I request and I got that his treatment take place on Monday, the only day of the week he was not performing. I decided to see him every week, every Monday, to monitor and keep his immunity. For me, the challenge was enormous. His platelet and neutrophil count stay remarkably steady throughout his treatment. No chemotherapy session have been postponed. No performance was cancelled. Once again, my protocol was very effective. The challenge was won. Here is now a clinical case. Mrs. B, 75 years old, treated for intestinal cancer. The treatment was about oxaliplatin and Avastin every 3 weeks. I practiced an acupuncture session before and after each cycle of chemotherapy. But before the third chemotherapy session on July 11th, his neutrophil size dropped to 560. I immediately practiced a new acupuncture session, and 4 days later, the neutrophil size raised to 2,300. The next chemotherapy courses can take place on the scheduled date. For information, it's important to know that it takes less than 12 hours to increase the neutrophil count and about 48 hours to raise the platelet count. Here is a case of a patient treated for breast cancer. It was, a woman, 42 years old. She had 6 cycles of FEC. FEC is an association of 3 molecules. It's pharmorubicin, epirubicin, and cyclophosphamide. Every 3 weeks, I treated them before and after each cycle of chemotherapy. Obviously, they practice a blood test before each session of chemotherapy. And you see, before the chemotherapy number 2, the neutrophil cells are 2,164 and platelet 688,000. So large margin. Yes, but few days later, 6 or 5 days later, she called me because she feeling not very well. I ordered a new blood test and we observed that his neutrophil fell down to 264 and platelets fell down a lot too. So I decided to practice in emergency a new acupuncture session. And 4 days later, you see 10 October and October 14th, you see the neutrophil count drop to 1,610, and the platelet 663,000. Yeah. So after the chemotherapy session, you see the neutrophil count and the platelet are very well offer to us a large margin of safety. Chemotherapy before the chemotherapy number 5, platelet are 2,300 and platelet the same quality of result. So just before the last chemotherapy session, neutrophil count 1,800 and platelet. So all these chemotherapy sessions are be doing as a scheduled date. In my practice, I have thousands of patients similar in this case. It's important to know that importance of organization acupuncture session according to the chemotherapy session. When the chemotherapy are separated by 3 weeks interval, it needs one treatment of acupuncture 48 hours before the chemotherapy, and another treatment of acupuncture immediately afterwards. For the weekly courses of chemo, one treatment of acupuncture just before or just after the chemotherapy. This organization determines the goal result. To conclude, a very important point. I continue to follow all my cancer patients every 3 months. Most of them tell me that they were the only ones in their family who did not get sick in autumn or in winter. In other words, their high immunity effectively protected them. In an upcoming Congress, I will present the protocol points which allow you to significantly slow down the loss of hair, the eyelashes, and the eyebrows. Thank you for your attention.